Thank you so much for joining us today for our pre-op testing work group. I had mentioned this a little earlier, but we are switching gears a little bit from the presentation that was advertised in our mail outs earlier this week. Um, we were anticipating having a presentation from Bronson Healthcare kind of at the system level, but unfortunately they were not able to join us today. So instead, I'm going to be walking us through kind of a review of MVC's multi-payer pre-op testing reports that are available on our data registry. I will also be walking through sort of a demo of those reports, how to manipulate them and hopefully use them to your benefit in your QI work. And so for that reason, today's meeting is going to only be partially recorded. We'll share as much of the meeting slides and recording with you as we can, but due to the fact that I will be sharing some unblinded data from Bronson, we won't be recording that portion. We also ask that you please mute yourselves throughout the presentation unless, of course, you want to unmute and ask a question. That is very welcome. It just helps us reduce the background noise. So if you notice as you join, we're muting you. That is why. We'll also be monitoring the chat throughout the presentation, so feel free to add questions into that chat function. We'll have a dedicated discussion and question and answer session at the end. For those attending this work group for P4P credit, we really look forward to your active participation. I've got a couple of polls, and then there's also the opportunity to engage with us during the discussion portion of today's work group. The post-work group survey will be shared at the very end of our work group in the chat function, as well as in our follow-up work group email if you're looking for that. Okay, so our agenda for today's work group, I already reviewed those housekeeping and P4P credit reminders. We will then review our presentation on MVC's multi-payer pre-op testing reports and as well as that registry demo, as I promised. We'll then follow up with discussion and Q&A, and then very briefly review MVC's upcoming events and updates. All right, so I am your presenter today. My name is Emily, and I am one of MVC's site engagement coordinators. My teammates, Rachel and Jessica, are also on the call today. Thank you so much for joining us. All right. So I wanted to start off with just a couple of slides reviewing sort of current trends in pre-op testing rates based on MVC's available claims data. So we can see here overall preoperative testing rates have generally declined based on available claims data from about 44% in 2022 to about 38% in 2025, keeping in mind that due to data lags with claims data, we don't have complete data for 2024 and 2025 just yet. So those trends might shift slightly as we obtain more data. And then here we can see between 2023 and 2024, preoperative testing rates prior to low-risk surgeries have ranged across MVC's collaborative from about 8% to 77%, noting, of course, that we only have Medicare claims data through June of 2024 for these rates. So each of those very colorful dots on the screen represents an individual hospital site that's a member of MVC's collaborative who had enough episodes of care to contribute to a rate for pre-op testing. All right, so as a review, MVC's measure definition for preoperative testing includes a numerator of episodes where preoperative testing occurs in the 30 days prior to an MVC-defined low-risk surgery of either laparoscopic cholecystectomies, inguinal hernia repairs, and lumpectomy procedures. For any of those listed test types, urinalysis, pulmonary function tests, chest x-rays, EKGs, blood tests, and cardiac tests. This does not include patients with certain comorbidities or episodes including an ED code during that index event. And then the denominator for this measure definition is all elective and outpatient MVC defined cholecystectomies, inguinal hernia repairs, and lumpectomy episodes with a length of stay between 0 and 2 days. I wanted to note that you may see some slight differences in MVC reports as it pertains to the test types that are included. So that first column there indicates the test types included in the multi-payer registry reports, which we're going to take a look at today, as well as any P4P reporting related to MVC's program years 26 and 27. Any past reports related to program years 24 and 25 have that slightly shorter list of test types included on the far right. Okay. MVC's pre-op testing multi-payer reports became available a little over a year ago. Why we shifted our reports to the registry as opposed to providing them to you as a push report as we previously had was kind of related to these 4 points. First, we rolled up our preoperative testing metrics into MVC's and MSQC's P4P programs, offering additional and more specific online reporting related to those P4P programs. It also helped us improve the visibility of our Right Size partnership, which is one of MVC's 2 value initiatives, a collaboration between MVC, MSQC, and Improve. The reports on the registry also helped us offer support from our diverse data needs from our users and various partners. We're able to provide more expansive data related to our various payers, date ranges, procedures, and then, of course, that can be supportive of the right size pilot evaluation as well. And then these more dynamic registry reports allow our users to apply more custom filters than would be available in sort of a PDF report sort of format. So what multi-payer reports are currently available? MVC currently has 2 suites of multi-payer reports available on our data registry. That suite we're going to be talking about today is focused on preoperative testing. It's going to include a preoperative testing kind of summary table, as well as a preoperative testing trends chart and a preoperative testing utilization rankings chart, which we've already kind of seen some previews of in those previous slides. And then we also have another multi-payer report suite focused on cardiac rehab, which I'm not going to touch on today. If you're interested in that, feel free to attend our cardiac rehab work group presentations. Those come up quite frequently during those meetings. There are a variety of filters. As I mentioned, this was one of the perks of getting to move these reports onto the data registry. We have a lot of different filters available. So these include being able to adjust for exact date ranges for the episode start dates. You have the ability to include or exclude all of MVC's available payers. That includes the Blues, commercial Medicare Advantage plans, Medicaid, and Medicare. You can also filter by procedure. Any or all cholecystectomy, inguinal hernia repair, or lumpectomies, as well as by test, And then additionally, various patient characteristics, including age, gender, race, ethnicity, and various comorbidities. Okay, so I'm gonna put up our first poll, just out of curiosity to get a sense of who's in the room. I'd love to know if you've ever accessed MVC's multi-payer reports. And I realize I didn't specifically note pre-op testing reports, but curious as to who has actually gone into the pre-op testing reports here. And I'm noting that there are a couple folks who have indicated they do not have access to the data registry. If you don't have access to MVC's data registry but would be interested in obtaining access to it, please get in contact with us. I've got a couple slides at the end that walk you through how to request access. The most immediate way is to just email us. And I've got our email on our very last slide, and we will work towards giving you access to our registry. All right, looks like we've heard from most folks, and it looks like we're somewhat split between having accessed these reports in the past and having never accessed these reports, with actually just a couple more folks having not accessed the pre-op testing reports. Okay, sounds good. And I'm going to go to our next poll. For those of you who have accessed MVC's multi-payer pre-op testing reports, can you let me know, have you used it to support any QI work that you've been working on? Maybe to facilitate a conversation with your pre-op testing team or your surgeons, or maybe to support your status or evaluate your status if you're engaged with right size. Variety of different ways we might be using this data. Okay. I'm realizing now that only I can see these results right now. So I'm going to share those results with you. Had most people participate. So we're looking at, a couple of you have engaged with using these reports to support UQI, but most who have access have not been using them to date. Okay. All right, get that out of here. All right. So we are going to start moving into the registry demo. Like I mentioned before, not all of this meeting is going to be recorded due to the fact that I am going to be sharing some unblinded data. Because Bronson was unfortunately unable to join us for this presentation today, they did agree for us to utilize their data as a part of our review of these reports. They had some interesting trends in their reports that we'll kind of get to take a look at as we review the functions of these various reports. So with that in mind, please don't take screenshots as I'm walking through the reports today. If you are someone who just wants a summary of the available reports, I'm happy to provide blinded screenshots of those for you at a future date. And I actually will probably just include those in the slides that we share with you in the email later. All right, so we've done kind of a review of MVC's preoperative testing reports. I hope for those of you that have access to the registry that haven't taken a look at those yet, that might prompt you to get in there and hopefully utilize them. And then we also walked through some of those reports with Bronson's data as an example. Thank you again to Bronson for allowing us to share your data today. With the time that we have left, I wanted to open it up to see if anyone had additional thoughts or questions on, what would be interesting to investigate further into that data. I sort of noted that maybe EKG rates for Methodist looked interesting to take a look at a little bit deeper. But did anything else kind of stand out to anyone on the call? And if not, that is totally fine. All right. An additional discussion question for those of you who noted that you have utilized MVC registry reports and specifically these multi-payer reports in your QI work. Would anyone want to speak to how they've utilized those reports thus far in your work? Were a couple of you who noted you had used them. I'm curious as to this is if it's more related to involvement with the right size initiative or if it's been independent inquiry.
Normally it's
April, I see you
April.
unmuted.
Yes, so I am from Trinity Health. I am the regional supervisor over the 9 hospitals in Michigan for quality. So I've used it just to compare the 9 hospitals together,
Hmm.
so that when I'm meeting with each administration at the individual sites, I do have a kind of um, format that I can go by and have some
Hmm.
data to back me up as well as our registry information. The more
Great. Yeah, so you're probably using those trends and then the benchmarking reports quite a bit to provide kind of an overall view of, where each site within Trinity's system is sort of situated. Great. Thank you for sharing that. We had a couple other folks share in the chat. Joe is utilizing this data related to their work with right size. That's great. And then Jennifer noted that they're utilizing the data as related to their MSQC P4P project. That's lovely. Okay. All right. And then last but not least, would anyone want to share thoughts on additional topics or reports that would be helpful to see in future registry availabilities? Is there a specific multi-payer style report that would be of interest or an expansion on these pre-op testing reports for those who use them? I know in the past we've heard more follow-up related reporting would be helpful. Marcy suggesting reports to look back at marquee cases. Okay. All right. Hip and knee cases specifically. Yeah. All right. Any additional thoughts on topics that you'd find helpful to see in our registry reports? Okay. I'm just going to then quickly remind the folks that noted they do not currently have registry access. If that's something that you are interested in, please email us, or you can request access directly through MVC's website. If you visit our website in the upper right-hand corner, there is a little prompt to, request access to MVC's registry. You are welcome to use that. It will prompt you to fill in a request user access form that just starts us off with some information about you. We will then follow up with you to confirm your request and then send you a website confidentiality agreement to have you sign that. Okay. And then after returning your WCA, we will provide you with a username and directions for logging in. Sorry, I was getting distracted by some of the chats in here. Okay. Monica asked, um, do we have information on who ordered the tests, PCP versus, I'm not sure what PSS is. Is that?
Surgical screening.
Oh, okay. Gotcha. Anesthesia or surgeon. There we go. Um, So within claims data, we're not able to see on a consistent basis the ordering provider. What we typically can do in a custom report format is provide you with an idea of the preoperative testing rates as it relates to the surgeons who completed the surgeries. We've also done a couple of custom reports looking at PCP kind of visits prior to those preoperative tests, or kind of like prior to the surgeries, and then as it relates to preoperative testing rates. I just saw Janet pop back on. If I don't know if she wants to speak to that in any more detail. Janet is one of
Yeah,
our lovely analysts.
yeah, but I've been working on right size or custom reports for pre-op testing quite a bit, and we have had questions coming from hospitals asking if we can see who ordered those tests or how can we attribute the ownership of those tests. The most matured way in MVC data currently is to attribute those tests with the surgeon who had performed those surgery for the index event. That will be the hernia, cholecystectomy, lumpectomy that we have talked about. For some special cases, we have been doing custom reports on PCP level, but those were really restricted to hospital that knows a full list of their PCP provider for all of their patients. And as you can see in these cases, usually those are smaller hospital. We don't expect a big system or big hospital to know every single PCP provider for every single patient. That will be a little bit unattainable. Um, on those on those one-to-one basis, we can provide some analysis on whether your patient visited the PCP or not. And those often are related to subsequently they had tests being done by PCP or other performances. So we can't pinpoint each and every test to a specific NPI, a specific provider, but we can use some proxies with limitations.
Great. Thank you so much for summarizing that, Janet.
Mhm.
Does that answer your question, Monica?
Yes, thank you. Because I worked on a project a few years ago, and it was a key component for us because we were doing the ordering. It was PCP. Sometimes it was during a physical, and they ended up having surgery after the physical, unrelated, but it was within that time frame. So there are some instances where it's beyond the control that affects the P4P. So in order for us to help figure that out, I was wondering if there's a way we could zero down further to get the information to the problem.
Gotcha. Thank you for the question. All right. Okay, so looking at our time here, I will just finish things out with a review of MVC's upcoming events. We have one work group in May. That'll be a sepsis work group on the 21st, featuring a presentation from Michigan Medicine. You should also be expecting this month MVC's final P4P scorecards. And then our spring collaborative wide meeting, which will take place in May. Registration is currently open until April 21st, and I will provide registration links for those events in our follow-up email in case anyone is interested in registering and has not done so yet. All right, and with that, we will conclude today's work group. Rachel will be adding the post-work group feedback, looks like she already did, in the chat. If you have any additional questions or concerns, I'll hang out here for another couple minutes. Thank you so much.
Thank you, Emily.